Hi, Dr. Cribb. Good afternoon. I'm Esha, a high school student who's interested in being a veterinarian. I'm excited to introduce our speaker today, Dr. Alastair Cribb, Dean and Henry and Lois Foster Professor at the Cummings School of Veterinary Medicine of Tufts University. He is also a professor at the Department of Comparative Pathobiology. Prior to this, he had a distinguished academic career, including being a professor and the founding dean at the University of Calgary in Canada. He served on the board of the American Association of Veterinary Medical Colleges, was president of the Association of the Canadian Faculties of Agriculture and Veterinary Medicine, was a board member of the Vaccine and Infectious Disease Organization, and served on the board of the Canadian Academy of Health Sciences. I'm thrilled to welcome Dean Cribb to the interview series on the careers of veterinarians. Thank you so much for chatting with me today.
Well, thank you very much. It's a pleasure to be here. So first of all, you can call me Alastair. I don't go by Dean and I don't go by Dr. Cribb unless I'm in a professional environment and we're just having a nice conversation here. So just call me by my first name.
Okay. So first, could you tell us about your education, training, and your career path that allowed you to become successful in your career?
Sure. So as you mentioned, I'm from Canada originally, and so I was able to get into veterinary school after only 2 years of undergraduate education. So that's a little bit different in the Canadian system. Lots of people have a bachelor's degree now. So I took 2 years of general arts and science, and then I applied to get into the veterinary school at the University of Saskatchewan. It's called the Western College of Veterinary Medicine. And I completed my veterinary degree there in 1984. I, in fact, took a year out to study in Europe between my third and fourth year of veterinary school. And after that, I did an internship, a rotating small animal internship at Michigan State University, and then I entered the workforce.
Thank you so much for sharing that. That is super interesting. So next, could you discuss about the pre-vet and vet programs at Tufts and the type of work that you do at Tufts?
Sure. So I'm going to start with the type of work I do at Tufts because that's the easiest. I'm the dean here, so I run the ship basically. And I still teach. I teach veterinary pharmacology and veterinary clinical pharmacology, but my primary role now is as an administrator. So what do we offer? So I run Cummings School of Veterinary Medicine. That's part of Tufts University. So at the veterinary school itself, we don't offer pre-veterinary programs. Students at Tufts University who are interested in going to veterinary medicine will follow our Bachelor of Arts or Bachelor of Science program, whatever interests them the most. And there's not a predefined pre-vet program. I think that's actually an important point because many students think they need to get into a pre-vet program. You don't. You need to complete the prerequisite requirements to apply to a school, but you can really follow any program that you want that really interests you. In particular, here at Tufts, we take students with all kinds of different backgrounds. And so we don't offer a specific pre-veterinary program at Tufts, and we don't expect students to have followed a specific pre-veterinary program. So in terms of other programs that we do offer, obviously our most important program is the veterinary program, the DVM degree. So we offer a comprehensive 4-year program. It's a great program for anybody who's interested in all the broad careers in veterinary medicine. And that includes everything from One Health to research to policy programs to small animal veterinary practice, rural mixed practice, all those different programs. In addition to the DVM program, we do offer master's degrees, and a lot of veterinary students will either take one of the master's degree programs before they enter our program, or they may follow it afterwards. But we have a master's in animal and public policy. We have a master's in conservation medicine. We have a master's in infectious disease. We also allow our students to do dual degrees in master's in public health, a policy program with the Fletcher School at Tufts, or a master's in laboratory animal medicine. I can't remember if I mixed that up. We have a master's in public health jointly with the School of Medicine, and then we have internally the master's in laboratory animal medicine program. And of course, we offer PhDs and residencies and internships as well.
Right. Thank you for sharing that. That was very helpful to know. So next, could you talk about the most rewarding aspect of your career?
That's a really difficult question to answer. So let me go back to what I think you asked before, which is my career trajectory. And I told you I completed my small animal rotating internship, and then I entered the workforce. So that's in fact what I did. When I was in veterinary school, I became very interested in pharmacology. That's the study of drugs. And I thought that was a really interesting field. And I wasn't sure if I might want to explore that further, but the most important thing I felt to do, and it's always my advice to new graduates, is I wanted to go out and experience practice for myself. There's really two important reasons to do that. The first thing is it really solidifies your clinical skills. And the second reason is you really understand what it is to be in practice. And if you choose, like I did, to follow some of the other options, ultimately, you always know what it was like to be in clinical practice. And so you're never wondering, and you can always decide to go back to it once you've established yourself. So when I completed my small animal internship, I actually went into rural multi-species or mixed practice or rural community practice, whatever term you want to use. So it was a very intentional decision on my part to do a small animal rotating internship first, because I knew if I did that, I would get a lot of exposure to medicine skills, and I would get exposure to surgical skills as well. And I would get a broad exposure to some of the specialties. But I always intended to go into a rural mixed practice because I wanted to get a lot of large animal experience as well. So when I left that internship, I went to the province of Nova Scotia. I was already in Michigan. It's kind of towards the east side of North America. So there was a job out in Nova Scotia, which is just north of where I am now. And so that's where I went. And I did that for 2 years. In fact, I actually ended up working another practice as well in Nova Scotia. And the first practice I worked, we actually had 2 separate clinics. So I kind of worked in 3 different practices. And there were lots of that part of that job that were really rewarding. And it's where I got to do some of the things that people like to hear about as being a veterinarian. So I did a lot of large animal work. I looked after dairies. I looked after beef cattle. I looked after sheep. I looked after horses on the racetrack. I looked after animals in some of our national historic sites. And I also got to do a fair bit of wildlife work, and that was for 2 reasons. One was that there was a wildlife park near one of my practices, so I looked after the wildlife that were in the park, and that's where I got to do one of my most interesting things that people like to hear about, which is that I got to do surgery on a mountain lion. We had a mountain lion that was in captivity, and animals in captivity, as you know, can become quite stressed. And so one of the behaviors that they will do is they will eat their bedding. And so you really shouldn't leave them with straw bedding, but they had, and so this mountain lion had developed a gastric impaction from eating straw. So that's kind of an exciting thing to do. And then one of the other practices that I worked at, we were the wildlife practice for the province, which is the equivalent of being the state here. So when they had injured animals, they would bring them into us. And that was always fun to do, to look after owls and that sort of thing. And being a rural practice that was distant from any referral centers, I got to do a lot of small animal surgery that you might not typically do when you think of being in a primary care practice. So those were really rewarding and fun things to do. One of the things that always stuck with me, however, was one of my dairy clients who I've been working with for about a year. And when you're working with somebody who has production animals, so a dairy, you're looking after the animals, but you're also looking after their livelihood. And so obviously, animal welfare is really important. You don't want the animals getting sick. You want to make sure that they're producing healthy milk. You want to make sure that it's safe for people to consume. But I've been working with him for about a year, and you get very close to those clients because often you go and you visit, you go in and you visit with their family, you have tea with them inside, or many different things like that. You really become part of the community. But at any rate, after I'd been there about a year, we were just casually talking as I was leaving, and he said, "You know, you've made a real difference to my family." And I thought that always stuck with me. I was I was focusing on looking after the animals and making sure that they were well cared for and that everything was going well. But what struck him was that I'd made a difference for his family by caring for his animals. And that really is that principle. I'm sure you've talked about it on your YouTube channel of One Health, that when we look after animals, we're looking after people. When we look after the health of animals, we're looking after the health of people. So that was all in the first, 3 years of graduating from veterinary school. And I decided at that point that I either wanted to open my own practice and run it the way I did, or maybe I should explore this pharmacology thing that I was interested in. I'm going to make the story really short here. But one of the things that I did, and it's something that I think students have a choice of many different veterinary schools should do, is I looked around to decide where should I go and do advanced studies. And I wasn't finding a place that really met with me as an individual. And somebody suggested that I should go and talk to somebody called Steven Spielberg. And so I did. Now, Steven Spielberg is not the movie guy. He was a clinical pharmacologist who worked at the Hospital for Sick Children in Toronto. And I just went to talk to him about pharmacology and see what he thought. And I had only been in his office for a relatively short period of time. I literally just walked up, knocked on the door. It turned out he was head of the division of clinical pharmacology at the hospital. And I explained who I was. I explained that I was a veterinarian, and we talked for a little bit. And he said, veterinarians understand intuitively that not everything's the same. And what he was really interested in studying was why some people have bad reactions to drugs, so we can't use them, and other people can tolerate a drug without any problems. And he said, I have a lot of trouble convincing people that people are different and that you can't just treat them all the same. But he said, you're a veterinarian, you understand that intuitively. How would you like to come do your PhD with me? So I did my PhD. I was a research fellow at the Hospital for Sick Children, and I studied adverse drugs in kids, and I studied adverse drug reactions in kids, and I studied the same adverse drug reactions occurred in dogs. And so I studied both of those, and I trained in human clinical pharmacology and veterinary clinical pharmacology. So that's how I got into that pathway, which is serendipitous. And I published a lot of papers over the course of my career around that general area, and that was very rewarding. And when I pick up a textbook now, I can pick up a human pharmacology textbook and my papers are referenced, and I can pick up a veterinary clinical pharmacology and my papers. Things that I did, things that I learned are quoted in there. And I did a lot of other things. I studied anti-epileptic drugs. I did a range of other things. But anyway, I went from there and I went to another medical school where I looked at how infections change the way we respond to drugs. And again, that's something that's important in people. And the reason that the person I went to study with was studying it was that we noticed that a drug called theophylline, used to treat asthma, that if you gave it to kids and then they got a flu, it changed the response to the drugs. And a long-acting formulation, so that's a formulation that stays in the body for the long time, suddenly became toxic. And kids would have seizures, and some of them had permanent brain damage, and some died. So that was the question that he set out to answer, was why was that? We have some of the same problems on the veterinary side, but we have an additional complication, which is that if you use a drug in a sick animal, for certain drugs, it changes how the body gets rid of them. So for small animals, sometimes that means the drug's not effective. Sometimes it can lead to toxicity. In sports animals, whether it's dogs or horses or livestock being shown, or treating sick livestock, how they handle a drug changes when they get disease. And so sometimes you can end up with residues that aren't safe or cause a violation, participation in sporting events or something like that. So again, it was one of those things that was important for human and veterinary medicine. So when I finished that, I ended up, I was trying to decide what I wanted to do. And so I could have gone to a veterinary school, I could have gone to a medical school, I could have gone to many different things. but I ended up working for Merck. And Merck is a major pharmaceutical company. And they hired me to do a job that didn't exist before. And they hired me again because I was a veterinarian. And I had all this other training, but I was hired because I brought the veterinary skills along with that other training. And my job, and it was really quite interesting, was when we first took a drug into people, sometimes some of those people would react unusually, right? So maybe you gave it to 100 people and 98 or 99, it was fine, and somebody looked like they had a bad reaction. Now you had to decide, was that a safe drug to develop? Did you need to make a different drug? And what about that 1 or 2 people that had the reaction? Like, was that real, or was that just chance that 2 things happened together? And could you figure out how to use it without giving it to those people? Or did you need to just not develop that drug and go back and try again? So I worked right at that interface between what happens in animals when you're testing the safety of drugs in animal studies. I did human studies, and that was very satisfying in a different way than being in practice. In practice, you have cases and you treat them, and most of them, fortunately, we do the right things and they get better, and it's very satisfying. But typically that happens over a relatively short period of time. Developing a drug or doing research takes a long time. But I can say that I helped as a small piece of a big machine developing drugs, that I helped to develop drugs for asthma. I helped to develop a drug for HIV. There's a drug that treats blood pressure in people. It's called losartan. And we had a problem with that drug when we first took it into people. There was a small group that didn't break it down to the body properly. We had to make a decision what to do. And I figured out what the problem was, what the reason was, why some people didn't do it. And I obviously worked with other people to do that, but I was the one who said, I think this is a problem. We need to test this. We tested. It was genetic variation in people. And in the end, it wasn't a safety factor. It didn't change how effective the drug was very much. And so we went ahead and developed that drug. It's on the market. And we're actually testing that drug right here at Tufts University, because it turns out that it also helps in cancer therapy in animals. So there's a drug that I worked on in a pharmaceutical company, and now we're testing it here at the university where I work to see if it can be used in animals for reasons beyond what it was developed for. So those were great and fun things that I was able to do, and all use my veterinary skills. And then I decided to go back into academia. So I was 10 years at Atlanta Veterinary College, and then I got the opportunity to start a new veterinary school in Calgary. And starting a new veterinary school and giving students who would not otherwise have a chance, perhaps, to go to veterinary school, to go, that was pretty exciting. And we did a lot of new things and different things at that school, and many things that are now developed or used by veterinary schools all over the world. And if you go online and you look up a company called Veterinary Simulator Industries, that company was started by my neighbor, because I went across the road. He was in the movie business, and I said, I need you to make me a simulator. Can you make me a simulator? And so he did, and I'm going to show you something here. You see that little let's see. Can you see it in focus there? A little cow model. So this is a cast of the original clay model that they had an artist make. This is Super Lady, this cow. And that was turned into a life-size model for simulation in calves. And we did life-size models of horses. We did all kinds of models with dogs as well. We did a spay model. There's now dentistry models that are all used in teaching veterinary students. So that's something that I helped start that somebody else did, but they're all over the world. We have them here in our veterinary school. They're in veterinary schools all over the world now. So that's a pretty exciting thing to have been even peripherally associated with, and was related to the veterinary school in Calgary. So I could go on, but I think what you see is, as a veterinarian, I've done many, many different things, and they've all been exciting and rewarding. I've been a veterinarian one, and I'm only involved in. And that's one of the things that's so great about the veterinary profession, is it allows you to do many, many different things. In fact, that's one of the reasons I decided to go into veterinary medicine. My father was actually a veterinarian, and I didn't give a lot of thought to what I wanted to do until sort of the first year of university. And I thought about it. I looked at all kinds of different things, and I said, you know, I could pursue many different professions, many different opportunities. But what I really liked about veterinary medicine was that I could see many different things, many different roles that I could play as a veterinarian that I thought I would like doing. And so I've been able to do that. I really enjoy veterinary practice. It's a really important part of who I was, even though I didn't do it for 30 years. I've continued to do veterinary practice, and even right now, I continue to practice veterinary medicine, both in what I do as a pharmacologist, and I actually go out and look after service dogs and things like that. So veterinary medicine is a pretty good profession, and you can do a lot of different things. Anyway, that was a long story to answer your question of, you know, what are some of the most rewarding things. There's just too many to count.
Yes, that's incredible. You have so many incredible accomplishments, and I think it's amazing how big of a positive impact you have on not only people but also animals. So next, could you talk about how you believe the profession has changed during the span of your career, and how you and other successful professionals have adapted to this?
Great. Well, you know, it's a good question. And it's really interesting because in many ways, veterinary medicine has changed a lot. And in many ways, veterinary medicine is fundamentally the same, right? It's about caring for animals and helping the people who interact with those animals. I use interact broadly because for some of us it's a pet, for some of us it's a working animal, for some of us it's a production animal, for some of us we really care about the environment, we can care about wildlife, and while we don't directly interface with those on an individual basis unless we're working, you know, like I described at a wildlife park or a zoo, or you're working at a wildlife clinic, but there's always someone on the other side of the animal. And when you're doing the part of veterinary medicine where you're directly working with the animals, that piece hasn't changed. There's always someone there, and how you interact and interface with that person is really, really important to your success as a veterinarian caring for the animals, but also to the successful outcome, right? It's about caring for the animal, and it's about caring for the person on the other side. That fundamentally hasn't changed. Those things that I've done, you know, you take research, the techniques that we use, the technology that we have at our fingertips has changed hugely. When I graduated, I had never seen an ultrasound machine. When I went to Michigan State University, that was the first time I saw an ultrasound machine, and there was one, and it belonged to the veterinary cardiologist, and nobody else could touch it. We now say that the ultrasound is our stethoscope. Okay, so they're much more expensive, they're much more sensitive. I can get a little ultrasound thing that plugs into an iPad, and I've got an ultrasound machine, right? So the technology is hugely different. A small individual personal computer that you have all the time, I didn't see that until I went back to do a PhD in 1987. I'm not saying there wasn't computers before and I hadn't seen computers, but actually working with one, you know, when I was at university, to interface with the computer, we had this big stack of cards with little holes through it. We feed into the machine. We didn't have personal computers like they exist now. So all that computerization, our ability to analyze data, MRIs, CTs, all those things are different. But fundamentally, you've got to be able to do a really good physical exam, and you've got to be able to get a really good history. That's where you have to start. That hasn't changed, but all these other tools, I mean, it's amazing. I teach pharmacology, and probably half or more of the drugs that I teach students about now weren't available when I started, right? And I teach about them. So that goes back to, how do you respond? How do you change? How do you develop? Well, you always got to be learning. So when you go to veterinary school, it's not about learning to do the spay. You have to do that. That's really important. But it's about learning the veterinary sciences so that you can learn, you can respond, you can interpret. When the drug company comes and says, try my new drug, you've got to be able to look at that and decide if it's right. When you get on the internet, some veterinarian somewhere says, oh, you ought to do X. You need to be able to decide if that makes any sense. You need to be able to go and find out the appropriate information and make that decision yourself. So you've always got to be growing as a veterinarian. And that doesn't matter whether it's in practice, whether it's in government policy, whether it's in food safety, whether it's in research. You are committing to a lifelong journey of improvement and learning new things and having new discoveries that you are then going to take and use to improve the life of animals and people and the environment. So lots have changed. It's our ability to respond and learn how to use information. So I teach pharmacology. I tell the students, my job is to teach you how to use the information that you're going to read, right? You got to learn some drug names. You have to understand how they work. You have to get some of the basic things down. But you're going to use drugs that I'm not going to teach you about, and you have to be able to understand about them. You're not going to remember every detail. You need to be able to pick up the textbook, read it, understand what it's telling you, then go and look at original articles and do all those sorts of things. So it is really that ability to always be looking outwards, use new information, learn, expand, grow as a professional.
Definitely.
That's what makes it rewarding, right? It's always changing.
Right. Those are some very insightful and very important points that you made. So next, can you discuss how or what high school and pre-vet students can do to prepare to become a vet?
That's a really good question. So lots of people decide, and it's not just veterinary medicine, it's lots of different career pathways. People decide quite young that they want to be a certain person. They want to pursue a certain profession. I mentioned earlier that I didn't decide till what many people would be considered quite late, but of course I was exposed to veterinary medicine for my whole life. So I was very well aware of veterinary medicine. So I didn't have to go out and learn what veterinary medicine was about. And so I do think that that's important to make sure that you understand some aspect of veterinary medicine that interests you, to make sure that you believe that that could be a successful career path for you. But at the same time, you don't want to get fixated on it's got to be this one particular piece of veterinary medicine. There's so many different things. Lots of students change as they go through. And you can't learn about every aspect of veterinary medicine before you even get into veterinary school or even apply, right? I've been in the profession, whatever. I guess I started in veterinary school 44 years ago. And I don't even now, I can't tell you everything about every aspect of the veterinary profession. I can tell you about lots of different pieces. So you do need to learn something about the profession, make sure that you understand it, and make sure that you understand and appreciate the role of veterinary medicine broadly in society. Obviously, there are prerequisite courses that you need to take, and you should do those because without those, you're not going to get in. And they are different between schools, but they're not hugely different, and it's not an unusual piece. And then students will often ask me, what else should I do? And I'm going to give you my opinion, and understand that's my opinion. And the specific entrance requirements at different schools, they're all different, right? Schools have different goals, they have different systems, but there's lots of broad commonalities, right? But what I tell students is what you should do now is you should do things that interest you. Don't try to say, I need to take these 10 additional classes that are above and beyond the prerequisites because I'm only going to get into veterinary school if I do those particular classes. Those particular classes don't exist. You need to pursue and do things that really interest you and broaden you as a person. And the reason I say that is once you get into veterinary medicine, once you get into veterinary school, and once you get into the profession, you get very, very busy and you get very, very focused. So you want to do as many things as possible before you get into veterinary medicine. So you've got a really broad base and you really understand who you are as a person. Okay. The second reason is if you're just doing something, a course, because you think you should do it, because you think that's going to help you get into veterinary medicine, you're probably not going to do really well, even if you're smart. You're not going to do as well as you would in a course that really interests you and you're taking because it interests you. Now, there are going to be lots of times when courses that do help you or that you think are going to help you get into veterinary medicine align with your interests, because obviously you're interested in things related to veterinary medicine. But really take this opportunity to develop and grow who you are as a person, because that's going to be with you for the rest of your life, right? I told you at the beginning that I did 2 years before I went into veterinary medicine, before I went into veterinary school. And then I actually took a year out partway through veterinary school to do more things and do other different things before I completed my clinical year. And that really helped me decide where I wanted to go with my veterinary degree after I had it. So I happened to do it then. You can do it before, it doesn't matter, but broaden who you are, do things that interest you, and don't try to do things because you think that somebody told you, oh, you should do that because that's going to get you into veterinary school. We take people, particularly at Tufts and many other veterinary schools are the same. We take people from all kinds of different backgrounds with all kinds of different histories, and we take them because we think they're going to make good veterinarians. And there's many, many different ways to be a good veterinarian, and the jobs are so vastly different. I described to you some of the things that I did. I didn't even tell you all the different jobs I had, but those, the skills of those different jobs came from all kinds of different things. So that's my main message. Yeah, you got to do your prereqs, got to do well. You want to have good marks because that's going to help you, but good marks alone aren't enough to get you in.
Yes, that's definitely some very great advice. So as a dean, what factors do you think students should consider when choosing which pre-vet or vet school to apply to?
So there's no such thing in my mind as a pre-vet school, right? So you go whatever university works for you, right? That could be financial reasons, that could be close to family, that could be because, you know what, I really kind of wanted to go and live in X, Y, or Z, or it could be that they offer a particular program that interests you. So, and some people really like a small school, some people like a big school, some people might be really interested in certain extracurricular things that school offers. So my advice is the same. Pick a school that matches you, who you are, and offers the programs that you want to do. And again, you don't have to do a specific pre-vet program. Yes, you have to do the prereqs, but you can get those prereqs anywhere. Okay, so that's the first part. And then picking what school you want to go to again, there's lots of reasons to pick different schools. The most important thing to understand, first of all, is that every veterinary school in North America is accredited by the American Veterinary Medical Association Council on Education. It's an accrediting body. It checks the standards. It doesn't matter which school you're going to go to, you're going to get a good education and you're going to be a good veterinarian. Who you are as a veterinarian is about who you are and what you do with the education that's given you and how you approach that education. Okay, so which school you end up at from a point of view of which will make you a better veterinarian, it doesn't matter. Any school. And I tell that students, you know, they come to me and they say, well, I'm trying to decide between your school and this other school. And I say, well, that's great. You got two great choices. Doesn't matter which one you're going to pick, you're going to do great. Now, so then what do you do? And so the schools offer different types of programs. And some of them are quite different. So you're aware of the term a distributed veterinary teaching hospital versus an on-campus teaching hospital. Have you discussed that on your program before? Yeah. Yeah. So I've taught in and I've been dean at both types of schools. Distributed veterinary teaching hospitals, right, where you don't have a teaching hospital on campus. You still have clinical things on campus, you still have research on campus, you have all the other things, but your students learn by going out into clinical practices in the community. And those are set up in different ways. The way we had ours set up, our faculty members worked in not all, but many of those practices where students went. So our faculty members are there as well. Some have that, some don't. But there's the distributed model, and then there's the on-campus teaching model, right? So you've got a teaching hospital on campus. So students used to ask me, well, which is better? Well, neither one's better. They're different. But one's not better than the other. And they're all accredited. And truthfully, one's not better than the other. But if it interests you as a student to say, well, I think that's really neat, I'm happy to travel around and go to practices all over the place and see those practices and see a lot of primary care practices and see veterinary medicine practice in different ways. If that appeals to you, well, distributed model makes sense. If you say, you know, it's really important to me that I know the people that where I'm going to do my learning, that I want to be in one location. I don't want to move around so much. Well, then you should go to a veterinary college that has an on-campus teaching hospital. It's not about which one's giving you the better education. They're different. At the end of the day, both are going to give you great education. You're going to be a great vet at the end, but which fits your personality. And you know, sometimes students come to me and they said, well, I really want to pick this school because of XXX, but I feel like that's a personal reason. I'm not making it based on some academic reason. I said, there's nothing wrong with that. Pick, if it's important to you to be close to your family, and there's a veterinary school that's close to your family, well, then that's as good a reason as any to pick that veterinary school. Now, on the other hand, if you say, you know, I really, like we talked about before, I really like to go to some other part of the States, or I want to go and see X, Y, or Z, and you got into both schools, that's a great reason to pick another school, right? There's all kinds of different reasons. The most important thing is you're going to get a good education in all of them. You're going to get a veterinary degree, and it's on you to make the most of that.
Yes, thank you for sharing that. That was very thoughtful. So my last question is, with your extensive experience, what do you think are the common mistakes that pre-vet or vet students make?
Yeah, that's a really good question. So I kind of alluded to one of them already. But before I comment on that one, so are you really thinking about the mistake they make when they apply, or some other mistake before?
It can be anything, really.
Okay. Well, I think one of the mistakes that students often make before, as I say, is instead of doing things that are important to them and help them develop, they try to predict what an admissions committee is going to say or do, and they try to do things that they think will get them into better school. Now, you have to do certain things. You have to understand about the profession, right? But somebody can go and work every summer for 3 summers at a veterinary practice and not actually be paying attention to what's going on around them and not actually understand the veterinary profession. Somebody else can go and work for a month and pay attention and be thoughtful and ask questions and understand about the veterinary profession. So the most important thing is, do you understand the veterinary profession? Not did you spend 12 months or 4 months or 1 month in a practice, right? So some schools, now if you want to go to a particular school that says you must have done so many hours of work in a veterinary practice, well, you're going to have to do that. But just in general, it's more about, do you understand the veterinary profession? Okay. Another mistake that I think students trying to get into veterinary schools will sometimes do is they'll say, well, I need to raise my average, so I'm going to go back and repeat this course. Well, repeating one course is not going to change your average. And it's also not going to broaden you as a person. So I don't, if you passed a course and you got a decent mark in it, don't go back and take a course again just to try to change your mark. You're not going to do it with 1 or 2 courses anyway, right? So again, don't try to do things that don't help you grow as a person because you think you're going to get it. Okay. The second mistake that I see is students, sort of the same thing. When they're in the interview or with other people, they try to tell the interviewers or write the essay that they think the people on the other side want to hear, instead of being truthful and honest, right? So you got to be truthful, you got to be honest, you got to be true to yourself. We can actually tell most of the time. I can't say we can tell all the time, but we can tell most of the time. And so, we'll sometimes get a student that'll say, I'm really interested in doing XXX in veterinary medicine. And then you look at all the things that they've done, and they've done all these other experiences. They've never done the experience that they say they're interested in. And we know they're just telling us that because they know that that's an important part of what we do at the school. So, that you've got to be true to yourself. You got to be truthful in your application. And I think the final mistake that people sometimes make, and this is a harder one, perhaps sometimes for people to understand, but they say, I want to go into veterinary medicine because I love animals. And what you really have to do is want to work with animals and want to work with people, right? It's working with the animals. I love my dog, right? My dogs are unbelievably important to me. I love my animals. I always had animals. But for being a veterinarian, I had to want to work with animals. I had to want to be fascinated by animals. I had to want to care about animals, and I had to want to care about people. So it's that animals and people, and there are things that I've done where I was absolutely being a veterinarian and using all my veterinary skills, and I wasn't necessarily working with an animal directly. I was doing all kinds of other things. But it is really that wanting to work with animals and that kind of fascination animals that's really important, not I love animals. And so I think you got to get past that and really think in the big picture about what it means to be a veterinarian, which is animals and people. There's always a person on the other side of the animal. Doesn't matter what that animal is or where that animal is. There's always somebody else on the other side. And for some animals, the other on the other side is society, but it's always people. There's always people involved. So you got to remember that about being a veterinarian. I think those are my things that I would say in my advice.
Yes, thank you for discussing the common mistakes that you see, and that was very great advice that you gave. So thank you so much for chatting with me today and sharing your experience and insights as a veterinarian, scientist, educator, and administrator. It's so inspiring to hear about your career journey helping animals and hundreds of future veterinarians, and I wish you continued success in your career.
Well, thank you very much. It was a pleasure. It was a pleasure talking to you. And I just want to reiterate that Veterinary medicine is a great profession. It is really broad, and there are so many different things that you can do with a veterinary degree. You will always have something to do. You will always be interested and entertained, and you will always be rewarded. And there will always be, I've got my, you probably can't see it here, but I still have my cow model beside me. It's a little bit fuzzy there, but you always have your animals in your life. And that's a pretty enriching thing to have.